This meeting is being recorded.
Okay, so very good evening to my fellow friends. Okay, Gilbert and Cher. Okay, so I will be presenting on encephalitis for radiographic pathology. Okay. Ayun. So what is encephalitis? Encephalitis is inflammation of the brain tissue. It can occur due to few reasons such as infections, most commonly viral, such as herpes simplex virus. Other than that, the immune system attacking the brain, or we call it as autoimmune encephalitis. After that, post-infectious inflammation, when the immune system overreacts after an infection. When the brain swells, it can disrupt its normal functions, leading to various symptoms. Common causes of encephalitis. There are three causes of it. One of it is viruses, such as herpes simplex virus, HSV, varicella zoster virus, ZV, rabies virus, or enteroviruses.
Recording in progress.
Other than that, bacteria, fungi, and parasites also can be the cause of encephalitis. It is rare, but it is possible. Other than that, autoimmune conditions, when the body mistakenly attacks brain cells. Sign of and symptoms of encephalitis. It has two stages of symptoms. One of it is mild, and the other one is severe. So for the mild symptoms, is fever, headache, and fatigue. For severe symptoms, confusion or agitation, seizures, weakness in arms or legs, loss of consciousness, memory loss, and sensitivity to light, or in the scientific name is photophobia. Mild cases may feel like flu, but severe cases can be life-threatening. So imaging modalities for diagnosing and monitoring. How encephalitis is diagnosed. So here we have the infographic of how the encephalitis can be diagnosed. There are a few methods or ways that we can diagnose encephalitis. One of which is medical history and symptoms. Doctors can look for clues like recent viral infections or unusual behaviors. Secondly, imaging, MRI or CT scans detect swelling or damage in brain. They play a crucial role in the diagnosis of acute encephalitis. Detects brain signal changes that reinforce the clinical suspicion of encephalitis, especially when the causative agent is not identified. By lumbar puncture, it can suggest a particular pathogen based on the pattern of brain abnormalities. Okay, the third method to diagnose the encephalitis is lumbar puncture or spinal tap. Spinal tap, known as lumbar puncture. This method is when a needle is inserted into your lower back to remove a small amount of cerebrospinal fluid, the protective fluid that surrounds the brain and spinal column. Changes in this fluid can point to infection and inflammation in the brain. Sometimes samples of cerebrospinal fluid can be tested to identify the cause. This may include testing for infection or the presence of antibodies associated autoimmune encephalitis. Uh, Last but not least, blood tests to identify the infectious agent autoimmune markers. So samples of blood. So this test samples of blood, urine or excretions actually from the back of the throat can be tested for viruses or other infectious agents. Okay, so the advantages, limitations, and special characteristics for imaging MRI and CT scan in order to diagnose encephalitis. The advantages for MRI, superior soft tissue contrast. MRI provides detailed images of brain tissue, making it highly sensitive to detecting inflammation, edema, or structural changes caused by encephalitis. In the early detection for encephalitis, MRI can reveal subtle abnormalities in brain regions, such as temporal lobes in herpes encephalitis, that may not be visible on a CT scan. Other than that, as you all know, RI uses magnetic fields and radio waves, making it safer for repeated imaging. And last but not least, functional imaging options. Advanced techniques like diffusion weighted imaging or spectroscopy can identify specific pathologies and differentiate encephalitis from other conditions. However, there are limitations for using this imaging. It is time consuming because it takes longer than scan, which might not be ideal for critically ill patients. And it does cost more expensive than CT scans. Other than that, it is not suitable for patients with metal implants, pacemaker, or severe claustrophobia. Special characteristics, MRI is the gold standard for diagnosing encephalitis due to its superior ability to detect detailed tissue changes and abnormalities. Okay, this is the radiographic appearance for encephalitis, weighted and flare imaging, hyperintensities in affected regions such as temporal lobes, especially in herpes simplex virus, HSV encephalitis. So, frontal lobes, insula, or cingulate virus. Involvement of limbic structures is common. Thalamus, basal ganglia, and brainstem. In some types, like Japanese encephalitis. T1 weighted imaging. So in later stages, hemorrhagic necrosis may appear as hyperintensities like this. Cortical involvement may cause subtle contrast enhancement. Okay, moving on to CT scan. So there are three advantages that are present for using this imaging. Speed, CT is faster and more readily available in emergency situations, making it useful for initial assessment. So this is very useful for like trauma patients. Detection of complications, effective in identifying associated conditions like cerebral edema, hydrocephalus, or hemorrhage. And last but not least, it is very cost effective because generally it is less expensive than MRI. However, there are a few limitations also for using CT scan. For example, lower sensitivity. CT has lower resolution for detecting cerebral brain inflammation, especially in the early stages of encephalitis. Other than that, radiation exposure. It involves ionizing radiation, which may not be ideal for children or repeated imaging. It is also limited functional details because CT cannot provide the advanced tissue characterization or metabolic information that MRI can. A special characteristic that CT scan possesses is it is typically used in emergency settings for rapid initial assessment or when MRI is not available. It is more effective for ruling out alternative causes like stroke or trauma. This is the radiographic appearance for CT scan. It can vary depending on the severity, type, and stage of the disease. Some common findings that we can see include normal initial scan in early or mild cases, especially within the first 24 or 48 hours. The CT scan may appear normal. Hypodensities, focal or diffuse areas of low attenuation, particularly in the temporal lobes, frontal lobes, or limbic system. So this is the complications towards patients, neurological complications. So patient can perceive seizures, persistent or recurrent seizures due to brain irritation. Other than that, cognitive impairments such as memory problems, difficulty concentrating, and decreased intellectual functioning. Last but not least, motor deficits, weakness or paralysis in certain parts of the body. The conclusions is serious condition. Encephalitis is a life-threatening inflammation of the brain, often caused by viral infections or autoimmune reactions. The potential complications for encephalitis includes long-term issues such as cognitive impairments, motor deficits, seizures, or even chronic disabilities. So the preventive measures is vaccination, public awareness, and infection control are key to reducing incidence and severity of this pathology. Yes. Okay. So that's all from me. Thank you.
Any question?
Do you have any question?
Complication.
Uh,
Share. Started with you, share.
Well, actually, I have one question regarding the modalities. If there is a patient in a situation where MRI is totally not available at all in that place, in that setting, so is it enough to use just a CT scan alone to diagnose the encephalitis? I mean, up to what degree can it what diagnose the pathology itself?
sorry, Shah, can you repeat the question?
My question is, if a patient in a setting where MRI is totally not available, is it possible to use just CT scans to diagnose the pathology? I mean, given its nature that is not really tissue sensitive.
For this, so when the situation for MRI is not available, it is enough just to use CT scan. I mean, it is not very highly what to say very tepat, tapi dia sangat dia berguna jugalah untuk detect diagnosis tu sendiri.
Oh. Okay, thank you for the answer.
Or is it because beside the CT scan we can do another test, right?
You share.
Sorry, you can hear my voice. Is there
Yes.
Yes,
another
we can
then
hear you.
uh, because for the early detection of this type of brain infection, normally the doctor will do the blood test and uh, so
Oh,
the so the CT scan we can do it after the blood test, or we need to proceed with the MRI first.
Sorry. After the blood test, what is
Modalities, or
your
what is the diagnosis, what is the treatment, I mean no, no,
the
not treatment,
plan.
the plan after the patient we detects with the brain infection after the blood test. So CT scan lah.
after the CT scan and MRI? Okay, so
Mm.
the treatment after the imaging maybe will be biopsy.
Biopsy.
Yeah.
You mean the lumbar puncture, right? Lumbar
Yeah.
puncture.
Lumbar puncture and
Oh,
also maybe the such case maybe for example brain biopsy,
Oh yeah, because
but it will
the
be
brain
yeah
is related to the CSF fluid, maybe the lumbar
yeah,
puncture. Oh, okay, understand.
but it is very rare. Maybe a small sample of brain tissue might be removed for testing, but it
Mm.
is usually done when the symptoms are worsening and other treatments have no effect. So yes.
Okay.
okay. Thank you for the presentation.